Welcome, everyone. It's great to see so many familiar faces today. I'm Megan Simpson, the Program Director at the Greater Kanawha Valley Foundation, and we're so excited to have the folks from Blockwell Consulting joining us today for the Data on the Brain webinar, Why Data Matters and How to Make It Work for You. As you all might recall, or you might not, Blockwell led another webinar for us in April on writing outcome statements, and you can find that webinar on our website. Also joining us today are several members of TGKVF, our grants manager, Candace Krell, our program associate, Katie Smith, communications director, Jane Powell, and program officers, Derek Vance and Todd Dorcas. So we might have a few other staff members on. So if you all can just take a second, our TGKVF staff, and put like a little reaction emoji so folks can identify who you are. And I think this should capture their personalities. So leading the session today is Dr. Megan Gall and Heather Foster. Dr. Gall opened Blockwell Consulting after working for more than 15 years in nonprofits, and she's been dedicated to progressing civil rights in the United States. She holds a PhD in political science and a master's degree in geographic information science, GIS. Was excited to see a few GIS folks are registered today. Her professional and research history includes voting rights and redistricting, justice reform, and the criminal legal system, education equity, demographics, historic narratives, homelessness, LGBTQ rights, and other civil rights-based public policy and legal analysis. She is a subject matter expert in census demographic data and Voting Rights Act compliance, and she lives in Charleston. And Heather Foster joined Blockwell Consulting in 2022 as managing partner. Heather has worked with a variety of federal and state agencies in grant making and executive positions, overseeing large staff and portfolios of grant awards. She's certified as a federal grant manager and holds expertise in volunteerism, national service, and nonprofit governance. Heather lives and works from home in Charleston and loves working with West Virginia to strengthen the nonprofit sector. And you may or may not see her cat Holiday appear during today's webinar. So Megan and Heather, I will turn it over to you.
Thank you so much. Let me share our screen. Okay. Thank you so much for joining us for Data on the Brain. We're going to talk about why data matter and how to make it work for you. As mentioned, my name is Megan Gall. I'm not going to say much more because I already got a great introduction. I'm going to go ahead and say the same for Heather. She got a great introduction, and I will say you can learn more about both of us at www.blockwellconsulting.com.
Hi, everyone. I know some of you and some of you I have not had a chance to meet yet, but I always feel like I'm among a group of friends. I'm Heather. Thanks, Megan, and the Greater Kanawha Valley Foundation for having us here today. I'm just going to kick us off with a little bit of an agenda and some logistics for today. Definitely, if you have questions or discussion, please make good use of the chat. I believe everyone is going to be able to mute and unmute their own line, so keep on mute if you are not speaking, but we would love to see your faces if you feel so inclined to turn your video on. Absolutely love seeing all of you. And I will say that we have some time for question and answers at the end. So while we will try to address all the questions that you have in the chat, if we don't get to something, we'll kind of keep that in a parking lot and save it till the end and hopefully have a little bit of time to address it. Megan and I are both eager to work with you to help answer your questions. So if we can't get to it today, feel free to follow up with us and we'll share our contact information at the end. Just in terms of our agenda for today, we are going to spend a little bit of time setting a foundation, laying down some basic terms and data basics. We're going to talk a little bit about why data is important and 4 key ways it might come up in your work in the nonprofit sector. We're going to talk just a little bit about strong data practices for your own performance measurement within your own organization. And we're also going to think about how you might source data from other places like the US Census, which Megan is going to talk about a lot more later today. And then we'll share and discuss some examples and finish with that group discussion. We have prepared some participant materials. We will send those after the event, which will just review the information that we covered today. And we'll also share out the slides at the end. So if anyone doesn't have a chance to stay the whole time, you will still have access to the information. With that, I just wanted to go on and kind of talk a little bit about what data can feel like. I know it's common to kind of bang your head against the wall when you are looking for the perfect data point to respond to funder reports or to write and justify your grant funding proposals, or to articulate why your program is necessary in your community. In one of my past roles, I always wanted to combine data points for our annual reports, but often realized that because of our diverse funding sources, we had committed to reporting on slightly different information. It made it really hard to combine or roll up data in a way that was still strong and defensible. And that was something that if I had to do it all over again, I would go back to the drawing board, figure out what impact we wanted to make, and try to help set the agency up for success with our data collection practices from the beginning. Of course, that's not always possible. Funders are all different, so it wouldn't be easy, but I think there are ways to streamline and work more efficiently, and I would love to share that with all of you today. I think it's helpful to think about in advance, and it's often underestimated the amount of time and effort it takes to put strong data practices into policy and procedures in your organization. So as we're getting started, just a quick chat. If you have one data challenge that you are facing right now, what might it be? And feel free to enter that in the chat. As I said, we'll try to answer as many questions throughout today as we can, and we'll have that time for Q&A at the end. All right. So we are going to talk a little bit about what we see as 4 key reasons that your organization might need to use some good data. And first, I want to talk about the needs assessment process. So when you are filling out a grant proposal, almost every single funder will have some kind of request for you to justify the need or your community's need. You can do that through qualitative data or quantitative data. You can do it by showcasing your stakeholders in the community, how you have done needs assessments, how you have gone out and engaged the community in determining what the needs are and how you could fix them. Maybe it's a focus group, maybe it's getting surveys from community members. Maybe it's a data that is comparative. So maybe it's looking at your community versus other communities in the country. So lots of different areas here, but this is one of the most important ones where you are going to need good data. Second, you have a program intervention that you're proposing. Maybe it's to build a park in an area where kids don't have access to a safe place to play. Or maybe it's to put gardens on the west side, or maybe it is to clean up trails in Canal State Forest. Whatever it is, you want to show some proof that what you want to do is likely to be successful in achieving your goals or your outcomes. In some applications, you might be asked to provide information about why you believe what you want to do will result in a significant positive impact. This is really about evidence, and it's also related to data. So this is an area where you can source data from other people and find evidence that other programs have created and published to use to make your case. Third, we're going to talk a little bit about performance management. And this is, sometimes it's called performance measurement. Sometimes in a grant application, it might just be called progress reporting. But no matter what, when you have grant funding, you are most likely asked to report on your activities. You need to be able to demonstrate that you completed what you said you would complete, and what your funder is expecting you to complete as part of that agreement that you made. So collecting good data on your program helps your organization both reporting to your funders and continuing to build that strong relationship with partners but it also can help your organization adopt a continuous learning mindset. So when you're collecting strong data, you know how well you're implementing your programming, you know how the kind of difference you're making in the community, and you can learn from that and improve. So another important area. And then fourth and last, this one might not apply to everyone here, but evaluation scaling is something that is important. If you have an organization that is interested in collecting evidence for your own interventions long-term, you want to start out with some strong data practices. Again, this isn't for everyone. These are more large organizations that have kind of research or evidence requirements as part of the funding that you're seeking. But it's something to think about, because when you set your data collection processes up in advance in a strong manner, you can then save yourself time and money paying consulting folks and external evaluators in the long run. So just something to think about as a fourth example. So what we're talking about here is really two types of data collection. It's the kind you collect yourself and the kind you source from others. Megan's going to talk a little bit more about data sources and cover a few of the data basics for us.
Okay, so there are a few basic data definitions that we want you to know and know about. First, we have primary data. These are the data that you collect yourself, that your organization collects. Both of these are really, both primary and secondary are really valuable, but they do present different challenges. With primary data, you get to collect exactly what you want, which means you get exactly what you want, which is great. Problem there is you need to know exactly what you want in order to ask the questions to get it. And that can be more difficult than it sounds. And you have to actually do the data collection and data management, and that can be a thing. So, but the plus side is you get exactly what you need. The other hand is secondary data. These are data that are collected by other people and published for your use. We're going to be looking at secondary data throughout this presentation because we don't have any of your primary data to look at. You're the ones collecting it. Secondary data is the Census Bureau. It's all of the resources that we're going to give you. It's reports, things like that. One of the main challenges of secondary data that Heather sort of alluded to is that you don't get to have it exactly the way you want it. You only get that data the way they publish it. And then it's your job to get your data to sort of speak to their data and make them merge together. And that is a thing you can plan for in the beginning to make it easier on the end. It's a thing you can do on the fly if you've already collected data and need to merge it in. But it is the concern with secondary data. And finally, we have evidence reviews. Evidence reviews, which is basically research by other people, right? These are academic papers, these are organizational reports, things like that. And a lot of folks don't think of reports as data, but they really are. They are jam-packed with stuff. And make sure they're a reputable source, but once they're reputable, you know you can use it. You know you can use that information and data safely. I just want to throw out a pro tip for folks. This is what I do in my life. I have probably 10 or 12 stacks of note cards. When I'm doing data work, when I'm reading evidence reviews specifically, but even when I'm looking at primary and secondary data, I keep a stack of empty note cards. One fact per note card goes on it, and then the citation goes in the bottom corner, and then I put it in the stack that it belongs to. Are you talking about homelessness or poverty? And then anytime I need to write a blurb about poverty in West Virginia, I pull out my little stack of note cards. I have all the data points I need, all the citations I need, and it saves time. So that is my pro tip for you. A lot of times the folks that write the evidence reviews, those organizations, I've had a lot of luck reaching out to these organizations and saying, hey, can you share your data? That would be great. Sometimes they do, sometimes they don't. Sometimes they can't, right? So that is a thing. If an organization tells you, no, you can't have our data, sometimes they just legally, legitimately can't. But they put out these wonderful reports for us to use. It's always worth asking, but when they don't, they put out these reports for us, which is really, really helpful. Data come in a number of different ways. Data, just as a blanket definition, are facts and statistics that are collected for reference and information. Data can be a whole data set, a whole table in Excel, or data can be one little fact of Megan is 45 years old. That is data, right? So data come in quantitative form, which means it's in numbers and percentages and tables that you can sort from high to low. Think numbers. And we'll be looking at mostly quantitative data today. The second is qualitative data. Those think anything but numbers. Think interviews, focus groups, think documents, letters, emails, anything like that. Those are data. They're a different kind of data, but qualitative data, I value highly, even as a quantitative scientist, because qualitative data are what let you build that narrative around what you're saying. It's not good enough to say you have 70% poverty or whatever. You need that qualitative data of an interview for somebody saying, this is what it's like to be poor in my county, to give that number some bones and some weight. Data can be used to establish a need or evaluate performance or evidence for implementation on a program. We sort of touched on that a little bit, but it's good to reiterate. Data can be at the population or the community level or the individual level. So again, data about me. I'm 45. I have an address. I have certain color hair and certain color eyes, right? Those are data about me, the individual. It could be about my income or how I vote, anything like that. The other type of data is data on a population. So that's going to be things like, you have the residents of Kanawha County. What are the median incomes or housing patterns for people in Kanawha County or in the state of West Virginia? That is community level data. Data often come raw and unorganized. Lots of places like the Census Bureau put a lot of effort into making wonderful tools and easy to use tables. That is not everybody. Some folks, they're like, hey, we collected the data, it is on you. And we still love those people because they collected the data and they're letting us use it. But it means that when it comes to us, we might need to pull it into Excel and do some cleaning and do some work on it. And finally, data can come in the form of text, observations, figures, images, graphs and maps. I'm a map maker. That is my professional love. I very much believe in the power of maps to tell stories, and even symbols can be a data source. So there's lots of different ways that you can use data and statistics for what you're doing. One of the easiest ways, and this will make a little bit more sense when we dive into the census data, but one of the easiest things to do is compare your county to other counties. Is your county the lowest or the highest in any given indicator? Is it among the lowest or the highest in any given indicator? You see what I did there with my words? If you're not the highest or the lowest, are you among? Are you third? Are you, use words that are accurate and true, but still get your point across. And that county to county comparison can help say, yes, our county is above all the other counties in poverty or childhood hunger. You can do the same thing with state averages. You can say, take the same sort of thought, my county in terms of poverty, we have way more poverty than the state average, right? That is a very powerful indicator. That's a very powerful thing to put in your narrative, and it demonstrates need. Create narratives. Again, this is where qualitative data can be really helpful, but even quantitative data gets woven into those things. If you're working with veterans, you don't even need to necessarily compare with other counties to say there are 1,000+ veterans in my county that have needs, right? And then you can talk about those veterans. That's a single data point that you can build a whole thing narrative around to hang your work on. And make your story relevant to the reader. Why do they care? Why does your funder care? Why does your donor care? Why does your community care? What are you doing? Why is it relevant? The numbers help. It's relevant because we have the highest poverty in the state, right? And knowing that quantitatively gives you the power and authority to show up and know that truth. And then finally, if you're using work that other people have done, always cite that work, give those people the props that they deserve, let other people find those data. It's the best thing to do. And I'm going to kick it to Heather for more context on context here. And she's going to talk about some commonly missed points in applications due to the organizations not creating relevance or significance for their comparative data. And that's going to put a little bit more bones on what I just talked about. So Heather.
Well, Megan pretty much just summed it up, but I have read a lot of grant applications in my time. Many of those are part of like federal competitive processes. And one of the things that I see that trends that people miss the most is not putting their own local area into context that the reader can understand. So if you're in Boone County or Clay County, West Virginia, but you're writing an application to the state or to the federal government, the reader does not understand the situation in Boone County or Clay County. So you really have to paint the picture for them. And the shortest and easiest way to do that is by using data. A little bit later, Megan is going to basically do a mini clinic on the US Census. I think this is probably your best source for putting your community into a broader context. This is helpful, as I said, for state or federal applications, but it really is helpful for painting the picture of the work your organization is doing for any stakeholder. So it's something I would want to encourage you to think really carefully about. We are going to talk a little bit about elements of strong data. I referenced it before, but in the past, I might have joined together data points that were maybe similar, but not an exact match, or even rushed through a data collection process. And I discounted how much attention those things actually need. In the long run, that can hurt you in goal setting and your continuous improvement. It can hurt you in an audit or a monitoring visit when someone comes and says, well, how did you get that data? And show me the way that you put that together, and then really questions your methodology. That's not a situation that I want any of you to be in. So I really would love for you to think with me a little bit today about how you can improve your data collection processes. Strong data is valid. It is data that it measures what you want it to measure. What if your data collection included staff and volunteers, but you were only logging it as volunteer data, or you were logging it as participant data that you had collected? That might not be an exact definition match. And so you want to be careful to define what you mean and what you're intending to collect. It sounds simple, but it never hurts to just write a definition at the beginning. Think of what is included, but also what isn't included in the data, and make sure you communicate clearly about that with the relevant folks. Strong data is consistent. It's data collection processes that are deployed in a standard format. So for instance, if volunteers are counting miles of trails cleaned, but one volunteer rounds up to the next mile and another volunteer rounds down or doesn't round at all, your data collection process may not be providing consistent information. Strong data is accurate. Many of us are probably using Excel or some other spreadsheet for data collection. Double check, are your formulas working correctly? It seems like so simple, but sometimes you leave out a cell, or the sum function isn't adding up right, or it hasn't been updated, refreshed, and so it's not collecting all the information. Just never hurts to have someone assigned to just do a double check to make sure your math is correct. That's quantitative data, but with qualitative data, think about confirming with your focus group participants that the notes accurately reflect the discussion, that you're not missing any key points, or have two different note collectors to ensure you have accurately reported the conversation. Strong data is well documented or verifiable. I once had a situation where after the floods in 2016, our office was responsible for a lot of volunteers and AmeriCorps members that were coming through the state. We had to have registration forms for those, and then we reported that data to the federal government and the state government and to our stakeholders afterwards. The forms, of course, were muddy, messy, in some cases illegible. So when we were monitored, we needed to be able to track down source documents for all of those numbers. We were able to do this, but it wasn't as smooth as it could have been in hindsight. And so thinking about your type of grant, your auditor, the monitoring process, and how you're going to document and maintain your records is something that is important to think through at the beginning. And then finally, strong data is reproducible. If someone from outside your organization came in and looked at your data, they would draw the same conclusions that you did. And that's important because you want to be able to defend the progress that you're making and the impact that you're having in the community. So the next slide here is just a little bit of a life path, the life of a data point. And as we think about investing in strong organization practices around data, I just want to challenge you to think about each individual data point as like something like a baby that you have to carry from birth through its journey in life. You want to protect it along the way. You want to help it find its right path. You want to train it and make sure that it is supported in all of the ways that you would support a child or a pet. One way to build a strong data set is to start in thinking about this process and thinking about the life of your data point. You might need to train volunteers or staff, whoever's collecting your data. You might need to test out survey questions to see if they're clear and easily answered. And you'll want to protect your data along the way in terms of each data point. Some of our organizations are built in an intermediary structure where you have maybe a headquarters and then you have a lot of different parts of your work in the field. Those create situations where your data is more susceptible to being lost or being manipulated, not nefariously, but just accidentally. So think through all those processes and see what you can do to strengthen them and protect that data point. This next slide is really just a little bit about some of the things that could go wrong along the way. Maybe a respondent to your survey misread the questions. Maybe it was a Likert scale from 1 to 5, and strong was 5, but they thought strong was 1. So every answer is answered in the opposite way. Or maybe a staff member was dreaming about going to Taylor Swift and lost the surveys in their car on the way to the concert. And maybe a staff member accidentally deleted your prior collection of data when they were inputting it into your Excel. So just a couple of things to think about, and just hope that it illuminates all the different points in the life of a data point that could be making it vulnerable, and so making your data set vulnerable as well. Thinking about these things in advance goes a long way. So we are going to take a few minutes now and just get into some breakout groups. We're going to have some breakout discussions just to kind of get you talking and thinking about the data that your organization collects, what is working well, where you might have struggled, and share a little bit with your peers. We're going to have about 10 minutes in each group, and I have some questions here, which I will also put in the chat so you can follow along. certainly introduce yourself. I think one of the things I want to express to you here is that the life of a nonprofit executive is sometimes lonely. So make friends with the other people in this room and share the challenges that you're having and lean on each other. Share your contact information and reach out when you need support. There is no shame in that. In fact, it is something that I wish we all did a little bit more. So I'm going to ask Candace at the Greater Kanawha Valley Foundation if she wouldn't mind. We're just going to go into our groups and we're just going to have a self-facilitated conversation. Megan and I and the Greater Kanawha Valley Foundation staff will not be in your group, so feel free to share anything, any trouble you're having with data in your organization and what's working well. And then will you think about your data differently after today? Are you thinking about how you collect data now? And are there any insights that you've already had that you want to share with your group? When we come back, we'll debrief for just a few minutes, and then we'll have a quick break. So Candace, if you want to put us in our groups now. It's great to see. Oh, there's the recording. Welcome back, everyone. It's great to see your faces again. And just wanted to spend a couple minutes debriefing your conversations. How did they go? And feel free to just unmute yourself and share a little bit about some of your insights from your group conversation. You can raise your hand to speak. So we have about 60 folks.
I thought it was really helpful to do the breakout session just because the role that I'm in, I collect a lot of data and apply to a lot of grants. And I got to be in a group with some people that not only collect data and create reports, but they are also funders. So I got to get a little bit of insight on what funders are looking at whenever they are going through grant applications, a little bit about data that might be important for them to see versus some data that you might be able to leave out, and really just focusing in on, what is the most important whenever you're submitting a grant application or reporting to your funders.
That's wonderful, Ashley. Thank you for sharing. Anyone else want to share a little bit about how your group discussion went?
I don't know how to raise my hand. This is Jenny
Okay.
from Hand Outreach Ministries. I got some great information from Jenny, and I appreciate it. We collect information from our clients in social services, and we would like for that to be a less traumatic experience. And she suggested that we have maybe a peer on staff that would be able to administer those surveys when we're asking about reentry or recovery or experiences that we need to know about for grants that we write for food. Often people want to know, like, how many clients do you serve that are in recovery? And asking that question can just be very traumatic for people. So that was extremely helpful.
Wonderful. Thank you for sharing, Jenny. Any other insights from your group?
So I can speak with,
Go ahead, Jonathan.
Jonathan.
okay. I'll speak briefly. Just we share challenges that we have in our group. And you have the accuracy of reporting when you're working with multiple partners across the geographic area. Maybe you have stake in a particular grant, and you have to be on the same page, and that's just part of the data basics. And Margaret and Karen both talked about like Margaret was in our group, O'Neill, and she mentioned a re-education component, or maybe on a regular basis you're checking in. To someone else, Karen used the check-in point as well. So that was a phrase she used to get everyone on the same page, maybe on a regular basis, semi-annually, for instance, because even folks who've been doing it may be doing something wrong or forget something when it comes to the methodology you're using or the steps to report things accurately in a shared system that you're all using. I don't know if Margaret or Karen or Lou in our group want to share more about what we talked about, but that was what we covered.
Thank you, Jonathan. I know Nita, you had your hand raised.
Yeah, to tag team on that, one group member shared kind of how she inherited a system, and it's knowing what those sub data points mean. And that struck me because, like, oh, I'm going through that too. I'm not alone. So things like, hey, all, it's time for you to fill out these quarterly reports, and then no one knows how to do that. So then I myself have to look at it and figure out why there's questions about these sub data points and what actually needs to be done. So that was definitely a theme for us, is that consistency of training and continuity whenever you have all of these stakeholders who are reporting back to you, to make sure that everybody knows what all the boxes mean and how to fill them out.
Yep. Thanks, Nita. That's very helpful, especially when you're working with partners who are outside your organization. You don't control what they do. You can't require them. You don't have oversight over them. So where are the levers that you can push or pull in terms of your partnership agreement to make sure that you're getting what you need in a consistent manner? It can be very tricky. What else? What did other groups talk about?
I kind of brought up, and this is something I keep I don't want to say getting stuck with. It's just a challenge that I'm still learning how to kind of capture, is quantifying the more subjective things into hard data. It's really easy as humans to see, like, okay, I physically see this child smiling. I physically see, like, on this person's demeanor and what they're verbally telling me, absolutely, I know I'm making a change. On paper, it is so tricky to kind of give actual hard, good data for it. The Marshall grant writing, there's a great center in Marshall that's been really helpful with me trying to get that barrier. But that's just a challenge for me, and it's really tough, is quantifying the good I feel like I'm doing through hard, good, evidence-backed data, getting people to see what I feel.
Absolutely. That is very challenging. Thank you. And I
And
thank
very
you for
common.
referencing the West Virginia Grant Centers too. There's one at Marshall and one at WVU. And if you guys haven't checked that out, it's a great resource. It's really phenomenal that West Virginia has that available. So go ahead, Megan.
I was just going to point out that is the worry and problem you articulated is you are not alone, right? That is the hardest thing to do, is to figure out how to capture those more subjective, more qualitative things from your population. So that is tough and requires a lot of forethought. So very good thing for us to be talking about.
We have just a couple more minutes here. Did anybody have an aha moment about something you want to do differently when you go back after this workshop today?
I would like to make a commentary that this is a great discussion, because these points have been frustrating. We're on our like 47th or 8th year now. And because we go into schools and we have to collect data while we're there, but a lot of grants want, how did that apply to the whole end of the school year? And that's really difficult when we're helping the school counties get the grant and we have to do the reporting. So one thing I've found out about today, many new little tools to use, and also that we were already using tools and I'm not as stupid as I thought I was. So that was a great thing to realize today. And this is wonderful. Thank you.
Absolutely. Thank you,
I
Tanada.
love that you knew
perfect.
more than you realized you knew. I feel like that's true for every single person in this room. You all know more than you think you know, right? Because data seeps into our brains. Thank you for that comment. Elizabeth?
Thank you.
Yeah, I was just going to say, definitely got some ideas from our breakout session, like, for example, to collect stories using note cards. Sometimes I think it's hard because we don't want to, at least with what I do, we're trying not to make people feel like that we're asking them for too much information or prying or anything like that. So being able to give them something that they could anonymously write their story or give us whatever information they want, I thought was a really good idea that I got from our breakout session.
Thank you, Elizabeth.
And I like one of the things that I love what you said is the awareness of how much you're asking people for. And is it reasonable? Are you going to get good data back from that? Is it going to work?
So I think given our time, we want to take a little break, give everyone a chance to stretch, get up from your seats, move your body around so your brain's working. And so we're going to take a quick break. When we come back, Megan is going to take over, share some of her tips and examples on data collection. And then we're going to do a US Census deep dive. It's like a mini clinic. And I know that I'm really excited about that. So take 5 minutes. Stretch, move your body, get up off your chair, and meet us back here in this awesome environment in 5. And we will be starting the recording, looking for folks to come back. Feel free to give us a thumbs up when you're back at your desk or turn on your camera so we know you're here. And welcome back. I hope you had a good stretch break. Got your blood flowing. All right, I'm going to turn it over to Megan now for some tips on collecting your own data. And I do see there are several questions in the chat, so we're going to keep some of those until the end, and we're going to cover some of them, I think, in the content that's coming up. So keep the questions coming. Go ahead, Megan.
Thanks, Heather. So, tips for collecting your own data. First, know what you want to know. I have done this myself where I set up a survey and I ask questions, and then I get to the end of the program and I'm like, oh my questions do not answer the questions that I actually want and need to know. So write it down. What do you actually need to know at the end of this, and craft your questions to get specifically to that. Keep your data points and survey consistent over time. If you change your survey every time you give it, you'll never have that length. You'll never have the multiple data points to say at the beginning, this was the case, and at the end, this was the case. But if you keep your survey consistent, you'll always be able to say, this is how we were at the beginning, this is how we are now. Sometimes surveys and data points have to change. That is life. That is the English language. That is fine. Do those things incrementally, do them slowly, do them thoughtfully so that you have continuity in your data. Next, follow the census categories for things like race and ethnicity, age brackets, sex. And we're going to show you some of those categories. When you follow the census, you give yourself a gift at the end of your road, right? What the thing that Heather was talking about making your data talk to each other. You want to collect race in the same way census is collecting race, so you can give direct comparisons like we talked about, county to county, county to state, something like that. Also, the census puts a whole lot of time, energy, and money into designing these questions to get the most accurate self-reported answers. They legitimately put in decades of research. You don't want to do decades of research. Rely on them. Follow what they're doing. Next, you want to staff your effort appropriately. The biggest thing to bring a data collection crumbling to the ground is no staff to support it. You need staff for the collection, you need staff for the data input, you need staff for the data maintenance. Make sure every point of your data points journey, like Heather was talking about, is staffed. Incentivize when possible. We're going to talk a little bit more about this in the example, but what can you give your good people for their participation in your survey? Something, anything. The people like things. So what can you give them? And are you collecting what we call PII, personal identifying information? That's things like your respondent's name, age, social security, which you should only ask for if you have the most specific need for it. Things like that. If I'm going to give you information about my person, my PII, how are you going to store that data to protect it? How are you going to keep other people out of that data? How are you going to keep it so it doesn't get stolen? Keep your questions to a minimum of 5. You know, plus or minus 1 or 2 is not going to make or break a survey, but short, simple. People do not want to spend more than a couple minutes. We have very short attention spans. Give them quick questions. We'll go into this a little bit more. If you can give them a scale of like from 1 to 5, what do you think? Where they just have to circle, fast, fast, fast. Good. Give them maybe one open-ended question at the end, something like, what else should we know? That should be the only open-ended question that you have. Everything else needs to be on a scale or more quantitative if you can. Know your audience. How are they going to want to participate? What kind of incentives would drive them? All of those kinds of things. Make sure you give them privacy, time, something to write with, a clear place to pick things up and drop things off. These are your mechanics of your day. If they need privacy, make sure that you give them the survey at the beginning and collect it at the end. Make sure you don't have a staff member just standing there while they fill out their survey. Make sure you give them something to write with. Maybe investing in a little box of those little golf pencils is perfect to just give them what they need to finish off their survey. Make it clear where they pick things up. Make it clear where they drop them off. You can also go digital. There are tools to make that free now. And for example, you can get a Google account. You can create a survey in Google that you send to your people via text message or a QR code that you can make for free and let them, that's my cat, let them scan the QR code. It'll take you to a survey. That survey responses will automatically dump into Google Sheets. So you don't even have to have somebody doing that data entry, which is another point of error on your lifespan. So really think about these things. We did get a question about doing work with human subjects. That is trickier, and I don't really consider surveying your people human subjects. When you're doing real research on human subjects, what I would recommend is something called an institutional review board. Those exist in universities and probably other places. IRB boards, they exist to make sure that you do not intentionally or not intentionally do unethical things. And they will have, if you Google IRB, you'll find a lot of that on how to do that appropriately. So let's go through an example or two. So let's say,
Megan,
yeah.
before you
please.
start with the examples, I know we also had a question about collecting data in harder to reach communities. I wonder if you have any tips for that or if you plan to cover that.
Harder to reach communities. I would want to know a little bit more about that. Are they harder to reach because of internet access? Are they harder to reach because they're in a really rural area?
Good
I think
question.
that-
I'm gonna call out my friend Natalie Huggins and see if she wants to
Okay.
pop on.
Okay.
I went ahead and unmuted myself. For our data, we serve 61 counties at Girl Scouts of Black Diamond. So we have a lot of rural areas. Our volunteers might not necessarily feel comfortable asking for assistance, pride.
Mhm.
We also have a lot of cases of, lack of internet and the ability to be there and,
Mhm.
directly hands-on activities. And sometimes too, unfortunately, girls might be, have to be removed, either not necessarily from our program, but they have to move out of our troop jurisdiction because of, family issues or things like that, and are
Mhm.
harder to reach areas. So those are all of the different types of issues that we sometimes have with our, harder to reach territories.
I would love to explore this with you more in a real way, because I think we could get to something. Off the cuff, my gut is to say go digital, right? Kids, if you're surveying the actual girls themselves or participants, I don't know if they're all girls at this point, go digital. Get that to them digitally. Yes, you will miss some of the people that don't have that internet access. That goes to one of my points about no data set is perfect. You can only do what you can do. Because you're in 61 counties and you cannot be in all of those places, going digital and pushing that and saying to folks, hey, if you've got a friend who doesn't have internet, bring them over, right? Or you could do like, hey, if you're in a rural area and most of your troop doesn't have access, do it at one of your troop meetings with one person that has a computer and have each kid go in and fill it out, right? Be creative, try to help them get to that. And then again, if you can't get all of the responses, but you can only get responses from those kids that have internet in home, collect those data and then say that in your report. Say, we know we missed the kids that don't have this, and give a sentence or two about what that might mean. That is okay. As long as you say clearly what is wrong with your data, nothing's wrong with your data. That's my policy. Do you have anything to add on that, Heather?
No, I think that's good advice. Obviously, West Virginia is a challenge with broadband still. So it's something that I think folks will continue to struggle with. But I think that's good advice.
Broadband access and computer access is also something that we can get from the Census Bureau. So if you need to quantify that, we can. Okay, so moving on to an example. Let's say your organization is putting on a series of outdoor concerts to help the community members engage, appreciate the arts, get outside. Your concert goers are random folks. You want to gauge their enthusiasm. You want to gauge their progress through the program. So think about what you need in advance and how to collect it. Are your demographics important? If not, don't ask them. People don't want to give sensitive demographics unless they have to. So only ask if you need to. When asking for PII, make sure you ensure protection against that. Design questions that serve as both your proof of concept for future funding and your evaluation. And that can be tricky, but it is possible. And again, consider an incentive. So things like, is it going to be hot outside? Do people need water? Maybe you could give a ticket for every person that fills out the survey and they can go collect their free water. Maybe if you've got a series of concerts, and I thought of this because I'm stealing it from a band that I love, you make a bunch of really fun stickers and you say, come to every show, collect a new sticker for every show when you fill out one of these surveys, and make the sticker super cool so that people love it and want to collect all 6.
Hey, Megan. This proof of concept and evaluation, can you unpack that a little bit more? Like, I think that's a really important point, and I don't want to miss it.
Yeah, so the proof of concept, let's say we'll keep with this example. If you're saying we need folks in our community to get out and do more community-oriented things, and there's a hunger for it. Well, you putting on a program and a concert and getting survey feedback that says, yes, I brought my whole family. Yes, I talked to my community members. Yes, I would come back. You could use that to say, here's my proof that the community wants and needs this. And then that not only gives you the proof, but your legs to say, hey, this is what we need for funding. We have people that are going to come to these concerts. They're talking to their neighbors. They love it. They're dancing. Their kids are having a good time. And that's why we need your future funding. Would you add anything, Heather?
Yeah, I think that that's a really cool point that I hadn't even thought of before. But you know, if I'm thinking about it in maybe the role of like an ED of an organization, I'm thinking about I can collect data for my current grant progress reports, and at the same time, I can use that information as justification of my community need for a different application. And I think that is so helpful, just as I'm thinking about like what a process might be that you would go through. So thank you for spending a little more time there.
Sure. One of the other things I wanted to say was like, for incentives, maybe you want to do a big drawing at the end of the season. So every time you fill out a survey, you are entered into the raffle. Do your participants know when that raffle is going to be chosen? Do they know what the raffle prize is? Can you make it a really great raffle prize? Is it maybe tickets for all of next season's programming? Something like that. And then finally, just a note to keep it simple, right? Sometimes all you need is simple. Like if I'm thinking about a park and I'm thinking about the park use, and maybe I'm trying to demonstrate the park is getting used a lot and needs a little bit more funding. Maybe all I need is 2 people with clickers that count 1, 2, 3, 4, 5, one person counting the people coming in, one person counting the people going out. Send them out for random times. That's 2 people collecting data, and that's going to give you on an hourly basis or whatever basis you need, what kind of volume your park is serving. That could be all you need. And that's the cost of a clicker and volunteers or staff, because staff appropriately. Think through your user experience. Where are they going to pick up the survey? Where are they going to drop it off? Are you going to do paper? Are you going to do online? Are you going to use the QR code? When will you deliver this survey? Does your process make more sense? How will you complete the paper surveys? How will you return those surveys? Things like that. Just think through your user experience. And just a quick example, if you happen to know your patrons, do you want to do the survey anonymous, or would it be helpful to follow up with your membership? Still think about your incentives. If these are people that are buying season passes, like I said, maybe the incentive is for a drawing for next year's season. Get creative. Consider whether their motivations motivate membership. And then make sure you get a representative sample, not just from the loud voices in the room. And that is a good point, and that's a good thing to keep in mind about your data integrity. And that's why you want to make sure that you have signage and staff and get all of the surveys that you can. Okay. Anything else to add before I move on to the census clinic, Heather? Okay. So we're going to do a little data mini clinic for census data. I love census data, and you will hopefully feel that while I am talking. We're going to cover a few things. We're going to talk about why census data are great and what you need to be aware of. We're going to talk about a few additional resources. We're going to talk about how to find the data, and we're going to talk about how to think and talk about the data once you find them. Lastly, a plug to always fill out your census surveys. They are critical. Legally, you have to. And it really gives all of us the data we need. So, okay, census is your very best resource for data. They have done all the scientific work of designing good data collection, so follow their lead. They have dozens of different surveys, which translates into hundreds of thousands of different variables. They collect a massive amount of data, and literally they collect it for us to use. It is always free. It is always available, relatively easy to use. The data are released at several different geographic levels, and that's what this image is designed to get across. These data are collected at the national level, and then the same data table for poverty, for education, for whatever, are broken out into regions, into divisions, and then into states, counties, census tracts, block groups. Ooh, we got cut off, and blocks underneath here. Blocks are teeny tiny geography. Every square inch of our nation is assigned to a block, which is assigned to a block group, a tract, a county, a state, right? So these nested data really are powerful because it lets us compare counties to states, states to other states. Finally, they have data on basic demographics like race, ethnicity, sex, age. They have a ton of indicators on health, education, basic needs, really great things like that. And we're going to talk a little bit more about those. Couple things to know about the census. No data set is perfect, and every data set has flaws. The main thing to know about the census is to understand how they talk about race and ethnicity. They collect race and ethnicity, but they are collected as two different questions. First of all, we're just going to acknowledge that race is a made-up social construct that we use to organize ourselves. It is important to me to point that out. So all of these questions are basically made up in terms of how we categorize ourselves. That said, they ask everybody to define their race: white, black, Indian, Asian, other. You can add two or more races. This is different from ethnicity. And by ethnicity, they specifically mean only Hispanic or Latino and not. So everybody that answers, I am this race. I'll answer for myself. I am white and I am not Latino. This means that you'll get over 100% sometimes on the numbers for demographics, and we're going to tell you how to get around that. But just know that race and ethnicity are treated differently and categorized differently. Couple other things. Let's see, I'm going to rush through a few because we're a little bit short, but everything in the census is self-reported, meaning I'm telling the census I am white, I am not Latino, I am 45. This is great. We don't like people guessing. They're getting better about quantifying the LGBTQI population. It's not great yet. We are not good at counting Middle Eastern, North African yet. That is a category that is working on getting in. And we'll just move on. This is a data table. I know this data table is a lot, but you are going to get a packet post this webinar. And this is in your packet. This is a really helpful table to find a lot of data that a lot of you all are going to need. It's not going to cover all of your needs, but it covers a lot, and it's going to be a useful reference table for you. And we'll show you how. Okay, so now we're going to take a dive into two of the tools that the Census Bureau puts up for us to use. They're really great. I love them. And Heather Foster, please holler at me if I need to make the screen bigger. Is this helpful? Okay. Okay, so that link that we're going to give you that I just clicked it up here, you can see it takes us right to the West Virginia page. This is government quick facts, and it loads West Virginia automatically when you pull onto this page. And what I love about this is that you can go into this box and you can add all the counties you want. So let's add Clay County. Clay County, West Virginia. And give it a second, and then Clay County comes right up. Let's add another one. Let's add Boone. You can add counties, you can add cities, you can add anything. But I love this because it gives you your county to county comparison and your county to state comparisons, right? So if we just look at these data now, in just this one table, I have data on age, race, veteran status, housing, living arrangements, computer use, education, health, economy, all of these wonderful things. And you can just sort of print it out and pick at it. So let's see, in Clay County, we have nearly 4,000 housing units. We know in Clay County that recently, I don't remember when it was, but recently, your last grocery store just closed. That's 4,000 households without an immediate grocery store. We know that we have, let's look at the economy. Female workforce. We've got, let's see, 38% of the female workforce working. We might need a little bit more than that. You might say, I'm running a program on getting women ready for the workforce. We only have 38% in. 38 is below the state average of 49% by a lot. And you can use that in your work. Let's see, we know that, let's look at computers. Where are my computers? Computer use. This is really interesting. You have 80% of households with computers, means 20% do not have computers. Only 78 have internet access. So what does that mean for your population? What does that mean for your labor force? What does that mean for the kids that you're trying to educate? This is a great tool because once you get your data and you look at all your numbers and you think about them, you can map it. And, oh, wow, we are short on time. You can throw it in a dashboard. I love this dashboard because you can map it. Give it a second to think. You can map it. You can take a picture of this map and use it. Your legend is down here. You can come over to the side and pick any of the things that we just looked at. So let's look at broadband usage. And you can pull the hard numbers down here. And I love it. It's a great resource. Your other resource is data.gov. This is a little bit more intense, but I'm going to quickly show you how to use the reference table that I gave you. So I'm going to look up school enrollment. And from the table I gave you, you'll know that that's table S1401. Search for that. Oops. Pull out the table. Just put that. School enrollment. That's going to bring up for the whole US. You're going to go to geography over on the side, pick county, go all the way down to West Virginia. You can pick all of your counties right here, or we could just stick with our Clay and Boone examples. And then we have this whole table of school enrollment for Boone and Clay County. And you can go look at population enrolled in graduate schools. Maybe you're thinking about work programs for the younger kids in your community. This is an idea of how many kids are in school but not in graduate school and might need that kind of work and help. And those are two quick, really fast tools, and we blew through them. But please do reach out to me, and I'll give you our information, because I love this stuff and I'd be happy to talk through it in more detail. Okay.
Thanks so much, Megan. I think the information on how to navigate the census is so helpful. And I know you went really fast. So I did tell everyone in the chat, we're going to wrap up at 11:30. We want to honor your time. But if anyone has some follow-up questions and they want to just walk through that again with Megan, we can stay on for an extra 15 minutes after. So just putting that offer out there. I will say you are going to get a packet of materials. In that packet, you'll find the census table list that Megan showed you. You'll also find links to resources from federal, state, and nonprofit agencies on education, health, volunteerism, and nonprofit trends. Those links, we've looked at them all. We know they work right now. It's a point in time. It's probably not comprehensive, but they are the links to reference information that I would use if I was looking for information on these things. And then there's also just a very basic data collection plan template in your packet. So if that's something that you're thinking about now, how to improve your organization's data collection practices, you can take a look at that and it will help guide you in the right direction. I think now we have probably maybe not quite enough time for a lot of questions, but just one or two. If anybody has, a question that's really burning that they want the whole group to hear, now's your chance. And I will say, our friend Margaret Ann O'Neill is here. The United Way also has a great data resource called Alice. Margaret Ann, do you want to just give a really quick plug for Alice while we've got you?
Sure, and I will be quick because it is its own website and you can look at it for free about West Virginia and about 26 other states. It's so interesting when you're looking at the census data to compare that to the Alice data. So the website is pretty simple. It's unitedforalice.org. And just to give you briefly, ALICE is an acronym. It stands for Asset Limited Income Constrained but Employed. It's a clientele base that a lot of us work with. There are in West Virginia in 2021, a little over 711,000 households. Of those, 17% earned below the federal poverty line. So 17% were below the federal poverty line. An additional 31% were ALICE households. So in West Virginia, together with ALICE and those experiencing poverty below the threshold, we're about 48% of households, but you can access that data by county, by congressional district. You can compare county to county, much like Megan was showing you for the census data. So it's another piece of information for you wrapped around specifically West Virginia, or you can compare us to other states around us. Thanks for the opportunity to share, Heather.
No problem. Thanks for joining. And that link to Alice is also in your participant material packet, so you can find it there. With that, I'm going to say thank you for coming, and I'll just kick it over to the Greater Kanawha Valley Foundation to wrap us up. And I think that's Megan.
And I'm on mute. I can't believe I did that. Anyway, so thanks so much for joining us today. I know that I'm blown away by all that we have learned and discussed. This webinar will be available on our website in about a week. And I know that folks will probably want to revisit it. I know I will. There's so much that was covered that we need to deep dive. So data does matter to us at TGKVF, and because of that, we would really appreciate if you all would fill out the evaluation link in the chat, and we'll also email that to you along with the slides and the handouts and some links that were mentioned today too, such as the ALICE information. So everyone, please take a moment with us to thank Megan and Heather. We can do a little applause for their fantastic presentation today. Enjoy the rest of your day, stay cool, and stay on for some questions. Thank you again. So just speak up if you have the questions. Make sure you unmute yourself though.
I'm honestly just bookmarking all the links from the chat, so I don't have any questions, but I'm hanging on for that reason.
That's also what I'm doing.
Well, we have a lot of links for you in the handouts. And hindsight is 2020. I thought it would be confusing to send it in advance, but maybe we should have sent it like right before or something. But you will have ways to get a hold of us if you need us.
Mhm.
I really
And if the materials
appreciate.
don't make sense, please reach out to us.
Well, thank you so much. I really appreciate your all's encouragement for networking. It's always so helpful when everyone's kind of in the mood to share. And I feel like that's one of the biggest values from this training is when everybody kind of comments how we can all draw strength and collaboration from each other. So I just very much appreciate you guys doing this training today. Thank you so much.
Thank you.
Thank you.
Taylor.
We're glad it was helpful.
Thanks, everyone.